Hey, what's up everyone? This is Julie Reynolds, aka Nurse Jar. In this training video, I'll be demonstrating the 2022 Headmaster Testable Skill Catheter Care for Female with Hand Hygiene. Let's go ahead and get started. Hi, good morning, Mrs. Jones. How are you? Awesome. I'm Julie. I'm your CNA, and today I'm going to be cleaning your catheter, okay? All right, let me just sanitize my hands. Now with Headmaster, you have to use actual hand sanitizer to sanitize your hands whenever required to wash your hands. And you have to rub your hands until they are completely dry. All right, Mrs. Jones, before I get started, I just want to make sure your bed is in a low safe level, and it is. Your bed wheels are locked. I'm going to give you your call light in your hand. Just press that button if you need anything. I'm going to provide you with privacy by closing your privacy screen. Mrs. Jones, before I go gather my supplies, is there anything else I can do for you? Okay, I'm going to go gather my supplies and I'll be right back. Now, Headmaster supplies will be located on a centralized table that's easily accessible to you during your skills exam. Linens such as towels, washcloths, bath sheets, those items may be stored in a file cabinet. I have my bedside set up for Prometric, so all of my supplies are at the bedside, but I just want you to keep in mind that your supplies will not be stored at the bedside. There will not be any supplies in the bedside stand. Your supplies for Headmaster testers will be on a centralized, accessible table. So what I'm going to do when I collect my supplies, the first thing that I'm going to collect is a clean barrier to place on my table. You can either use a chucks or a towel. Once I place the clean barrier, I'll continue gathering my supplies. So you'll need one bath or wash basin, soap, one pair of gloves, 3 washcloths, one to wash the catheter, the second washcloth to rinse the catheter, and the third washcloth to dry the catheter. You will also need to collect another chucks pad or a towel to use as a linen protector. Mrs. Jones, I have all my supplies. I need to go put water in the basin, okay? All right, Mrs. Jones, I'll be right back. Now, it doesn't take a lot of water to clean the catheter, so I'm going to fill my basin probably right up to here with water. In your skill steps, it specifically states fills basin with warm water. So if your sink has 2 handles, you'll need to turn on both handles. If your sink has 1 handle, you'll need to make sure you turn that 1 handle to the center setting, okay? And that should get you some warm, tepid water. Okay, I'm turning on both handles. I'm testing the water. All right, so you will have to test the temperature of the water before you have your resident to test the water. I tested the water while I was at the sink filling my basin. That's fine, you can do that. But you need to make sure that you verbalize loud and clear and that you actually test the water if you're going to test the water at the sink. Or you can wait till you get back to the bedside to test the water. You can test with the finger, with your wrist, with your elbow. You can even test the water with the gloved hand, okay? All right, Mrs. Jones, I'm back with the water. I've already tested it. It feels fine to me. Now I would like for you to test it to make sure it's a comfortable temperature for you. At this time, some NAEs will speak for the mannequin, but if they don't, that's fine. You just go ahead and perform this step as I just did. It's good? All right. Thank you, Mrs. Jones. The next step, you'll want to put on your gloves. Okay, Mrs. Jones, I have my gloves on. I'm just checking your tubing to make sure that there are no kinks and twists and that there's no restriction to the urine flow, and everything looks good, okay? All right. So what you want to do is, if the bed is, or if you're too tall, you want to make sure that you raise the level of a bed to a comfortable working height for yourself, okay? Headmaster does emphasize body mechanics. The bed is at a comfortable height for me. So, Mrs. Jones, what I'm going to do right now is expose you so I can have enough working area, okay? So I'm just going to roll your sheets down to your knees. And I'm going to raise your gown to hip level. Okay, so you want to make sure that the sheets are not rolled down past knee level and the gown is not raised above hip level. That would be considered overexposure. All right, Mrs. Jones, the next thing I'm going to do is place a linen protector. Now, when placing the linen protector, it has to be placed completely underneath the resident's buttocks and peri area. Okay, I'm just lining it up here, making sure it's completely under your buttocks and peri area, and it is. On the count of 3, Mrs. Jones, I'm going to raise your hips so I can pull the linen protector through, okay? I'm just placing my arm underneath both thighs, and on the count of 3, we'll lift your hips. 1, 2, 3. Okay, you can lower your hips back down. Now, the way I place the linen protector is the most convenient and time management way to do it. However, if you're having issues with lifting the mannequin's hips, you can always raise the side rail on the opposite side or the same side that you'll be turning the person to place the linen protector. All right, Mrs. Jones, the first washcloth, I'm going to wet it. Squeeze out the water really good. I'm going to open it up, apply soap. Then I'm going to rub it together to get soap all over the washcloth. I'm going to fold it back in 4s. Now, Headmaster specifically states when washing the catheter, you have to use at least 2 strokes. Okay, 2 strokes just with washing. So you'll fold your washcloth in 4s. You'll hold the catheter at the meatus, meaning your hand should be touching the mannequin. You're going to take your washcloth, wrap it around the entire diameter of the catheter, and gently wash the catheter moving downward. And you'll do this for the entire length of the catheter, and then gently place it down. Now, for the second stroke, you want to turn your washcloth over to a clean area and wash in the same manner. Now I can place this washcloth on the side of my basin. In your Nurse Aide Candidate Handbook, it says to wash at least 3 to 4 inches of the catheter. However, what's 3 to 4 inches to you may not be 3 to 4 inches to the nurse aide evaluator. So to be safe, go ahead and wash, rinse, and dry the entire length of the catheter. My second washcloth, I'm going to wet it. I'm not going to apply soap. And now I'm going to keep it in fours, and I'm going to rinse the catheter in the same manner that I washed it. But this time I'm only going to use one stroke because Headmaster does not specify how many strokes you need to use when rinsing, only when washing, okay? So I'm going to hold the catheter at the meatus. I'm going to wrap my washcloth around the entire diameter of the catheter and clean downward the entire length of the catheter, and then gently place it down. My third washcloth, I'm not going to wet. This washcloth is going to be used to dry the catheter. Again, I'm going to dry the catheter in the same manner in which I washed and rinsed the catheter. So I'm going to hold the catheter at the meatus, wrap the dry washcloth around the entire diameter of the catheter, and gently dry downward, and then gently release the catheter. All right, Mrs. Jones, I'm done cleaning your catheter. What I'm going to do right now is remove your linen protector, okay? Now you can remove the linen protector in the same manner that you placed it. This is one of the most common forgotten steps, the removal of the linen protector. So while you still have her exposed, this is the best time to remove it. Okay, Mrs. Jones, on the count of 3, I'm going to raise your hips with my arm and remove the linen protector, okay? I'm just placing my arms underneath your thighs, and on the count of 3, 1, 2, 3, lift. And what I'm doing is I'm rolling the linen protector away from me, at the same time pulling it towards me. All right, Mrs. Jones. Now you'll immediately dispose of your linen protector. Because I used a chucks, I'm going to dispose it into the waistband. If you use a towel, you need to ensure that you dispose of it into the soiled linen hamper. Now what I'm going to do is cover Mrs. Jones up. I'm going to start by using my elbows. Usually during testing, the NAE will tell you to go ahead and use your hands. Okay, Mrs. Jones, I'm just going to cover you back up. There we go. All right. Now, Mrs. Jones, I'm going to go dispose of all of my supplies, and then I'll come back and get you in a comfortable position, okay? Your bed is still in a low safe position. Bed wheels are still locked. You still have your call light in your hand, and privacy is still maintained. So I'm going to dispose of my soiled linen into the soiled linen hamper. I'm going to take my basin. I'm going to empty it in the sink, rinse it, empty the rinse into the sink, and then dry it out. I'm emptying the basin. I'm rinsing the basin. And I am drying the basin. Now I'm just going to place the soap back into the basin and place it back into the storage area. Again, for Headmaster, you will not have any supplies in the bedside stand. So if there's a designated dirty area, that is where you will place your used supplies. Now I'm going to dispose of my clean barrier. Again, I used the chucks, so I'm disposing of it into the waste bin. If you used a towel, you will dispose of it into the soiled linen hamper. I will now remove my gloves without contaminating myself. Immediately dispose of them. Use hand sanitizer to sanitize my hands. And I'm rubbing the sanitizer in my hands until my hands are completely dry. Now I'm just going to place back the equipment. I'm going to get Mrs. Jones covered up more comfortably. All right, Mrs. Jones, I'm done washing your catheter. Is there anything else you'd like for me to do? All right, Mrs. Jones, you have a good day, okay? Your bed is still in a low safe position. Bed wheels are still locked. Would you like for me to keep your privacy curtain closed or open it back up? All right, Mrs. Jones, I'll open it back up. All right, Mrs. Jones, you have a very good day, okay? All right. Now, at this time, you will go wash your hands, perform hand hygiene with actual running water and soap. If your sink has 2 handles, you will want to turn on both handles. If your sink has 1 handle, you'll want to turn that 1 handle to the center setting. My sink has 2 handles, so I'm going to turn on both handles. I'm going to wet my wrists, hands, and fingers, then lightly clap my hands together to remove any excess water. I'm going to get a lot of soap and begin lathering. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000. You want to make sure that you lather your wrists also and interlace your fingers to wash in between your fingers, just like so. You want to make sure that you maintain your hands below the level of your elbows with fingertips down at all times during washing and lathering. 20 1,000, 21 1,000, 22 1,000, 23 1,000, 24 1,000, 25 1,000. Now I'm going to clean my nails by rubbing my nails on the opposite palm, just like so. Now I'm going to rinse all of the soap off of my lower arm, wrist, hands, and fingers, making sure I keep my hands below the level of my elbows with fingertips down and that I do not touch the insides of the sink. Now I'm just going to check to make sure I removed all soap. I'm going to gently clap my hands together to remove any excess water. I'm going to get a paper towel and begin drying my hands by drying each individual finger of each hand first. It specifically states this in this step. Now that I dried my fingers, I can go ahead and dry the remaining areas of my lower arm, wrist, hands. Okay. And then I'll get a clean, dry paper towel to turn off the faucet and dispose of that paper towel. Now, if your hands accidentally touch the insides of the sink, you will need to stop, look at the nurse aide evaluator, and let him or her know that your hands touch the insides of the sink and whether or not they would like for you to restart the hand hygiene skill. Once you've completed hand hygiene, you've completed the testable skill, Catheter Care for Female with hand hygiene. And you have to state skill complete. This allows the NAE or alerts the NAE that you are done with your first skill, and then that way they will take you to the relaxation room while they set up for your second skill. I hope you enjoyed this video and I hope it was helpful. It's my first Headmaster video. Yay! Thank you all.